Now, in the wake of the steep rise in the number of cases in Delhi and the projections made by the Aam Aadmi Party government indicating that the tally will reach 5.5 lakh by the end of July, Union Home Minister Amit Shah and the Health Minister Dr. Harsh Vardhan are currently holding a meeting with the Delhi LG Anil Baijal and Chief Minister Arvind Kejriwal along with members of the State Disaster Management Authority to review the situation in the capital. The objective is to coordinate and formulate a comprehensive response to handle the challenge. Now remember, this comes in the backdrop of the Supreme Court's rap on the capital's mismanagement. Well, we have my colleagues joining us on the broadcast. We have Arunama joining us from outside the MHA. We also have Rupashri Nanda, who tracks the Delhi government for us. I'll come to you first, Arunama. Now, of course, the centre's intervention comes after the huge surge in cases over the last couple of weeks in Delhi.
Yes, and the all India numbers, like we have been saying, in 10 days have gone from 2 to 3 lakh. Delhi has a huge contribution to make to those numbers. When the lockdown was on, yes, when the Tablighi Jamaat congregation happened, numbers started rising, but the situation was not half as bad as it is right now. One of the explanations being given by the state government is that Delhi was in a peculiar situation. First, the Nizamuddin congregation led to a spike. Then, because international flights started coming in, people carrying the virus, more of them started coming to Delhi. But the point is that even when those flights were coming in, even when the congregation happened, things weren't half as bad. Plus, Delhi government's insistence on opening up, that has also led to a spike in numbers, and the medical infrastructure is just not equipped. On the table today, we are told, as the meeting is happening, and the meeting is just happening on that first floor room behind me, room number 119, and also in the conference room where Home Minister Amit Shah usually engages. What we are told is that in that meeting, what's on the table is how to spruce up medical infrastructure. One of the suggestions from the state government is to convert stadiums into healthcare facilities, but then from where do you get the additional human resource, doctors, nurses, staff to help the doctors with? If you need ventilators, can that be done in these makeshift hospitals? Because for that, I think you will need proper medical care. So those are the things that are going to be discussed, sprucing up medical infrastructure. Containment strategy. Should we enforce containment in some zones at least where numbers are going up? This was part of lockdown 4, but in unlock 1.0, the freedom was given to Delhi government, and we are seeing how it is operating. So in just about 15 minutes to 20 minutes from now, we are expecting some kind of indication from inside about what was decided, what is the way forward for Delhi.
All right, stay on with us, Arunama. So in a short while from now, like Arunama was saying, we will have some kind of an indication as to what is happening in the meeting. But bringing in Sneha Murdani, who tracks the health ministry for us. Sneha, we know that ramping up medical infrastructure is going to be discussed, but getting beds available is still the easy part. Getting ventilators, having ICU facilities, as well as having adequate healthcare professionals, that is not so easy.
Yes, but what the government is saying, and this is from the health ministry, is that only a percentage of the patients really require critical care. So we're not really stressed about that. What they're stressed about is the fact that there are, in fact, deaths being reported in Delhi, and that is also increasing. Plus, the active cases is just second to Maharashtra in terms of active cases. So that active increase in the number of new cases should be going down and should be under control, and that only seems to be increasing. What I'll tell you is the other area of concern is the fact that in Delhi, though there's been just so much back and forth about community transmission, however, the cases that were studied in Delhi, and this was a patient suffering from influenza-like illness and severe acute respiratory infection, indicated and showed that many people in Delhi, and this was also true for Maharashtra and Gujarat, that they have coronavirus, they have COVID-19. So in that sense, that form of testing is showing widespread infection spread in Delhi. So there are many people who've not been in contact with coronavirus patients, but who have decreased lung capacity and are ending up getting coronavirus, ending up getting COVID-19. That is one concern. The other concern is that, yes, there is overwhelming of the healthcare infrastructure, but also by converting nursing homes into COVID dedicated centers. The sense that I get is that there is underutilization in some COVID dedicated healthcare centers, not just in other parts of the country, but in Delhi as well. in that sense, there are other patients also who come to Delhi for treatment for various infections, for example, tuberculosis, for example, cancer, or other forms of infection or any other disease are suffering. So how is that problem going to be dealt with? Because right now, on top of the agenda is COVID-19, but can we look away from the fact that for, in India, battling infectious diseases is really an everyday battle. We have a season of dengue, malaria, which is, there's going to be the onset of the same in days to come. How are the hospitals then going to cope up to deal with these infections? There are perennial infections really in the national capital. All of this is going to be discussed, and all of this is going to be chalked out, apart from the fact that how do you boost manpower? That's the biggest area of concern. Now, we've been talking about how Delhi hospitals, many of them run by the MCD, are not even paying their staff. Some relief for the temporary staff, but what about permanent healthcare workers? They have these concerns as well in the municipal hospitals in Delhi. How will that really be addressed? So a plethora of issues to be discussed at this very, very important meeting today. And that's the reason why top bureaucrat Preeti Sudhar, Health Secretary, apart from the fact Randeep Guleria, he is the AIMS director. He's also a part of the National Task Force. We have Dr. V.K. Paul. He's the head of the National Task Force. All of them in this meeting today to discuss the way forward. I've also been told that various other issues, not just healthcare infrastructure, but communication gap. Patients rushing to hospitals, instead of calling the helpline numbers to get an idea. Delhi app showing that there are beds, but hospitals say there are no beds. Why this sort of a mismanagement, really, apart from the fact that private hospitals are also charging? Is there going to be some sort of capping? That again is going to be discussed in days to come, if not necessarily in this meeting, but that is also on the radar.
Right, the communication gap with patients definitely needs to be plugged, because it's been leading to a lot of confusion and a lot of panic as well. Stay on with us, Sneha. Let's also go across to Rupeshri Nanda. Rupeshri, the Delhi government has been pretty regular with their press conferences. Chief Minister Arvind Kejriwal addresses, the citizens of Delhi constantly, and we can see the sense of panic constantly being notched up over the last couple of addresses. In the beginning, the Delhi government was claiming that there is no issue at all. We have enough beds. People are being treated at homes. The recovery rate is high. Over the last couple of days, however, he's constantly been talking about the burden on the existing infrastructure. Then, of course, we had him also say that Delhi hospitals need to be reserved only for Delhiites. All of this only indicating the gravity of the situation.
Absolutely, Vandana. In fact, it is a little surprising how, because I mean, how did the Delhi government not see what it was up against, or brace itself for what was coming? Because remember, Delhi Chief Minister Arvind Kejriwal always said that one has to learn to live with Corona, and also that Delhi government is prepared. They've used the 2 months of lockdown to prepare well for the capital, and the aim essentially was twofold. One, to keep the mortality rate in check, and number two, to ensure that anybody who needs treatment will be given that treatment. Now, even though beds are available in government hospitals, we've seen the kind of distress that is happening on the ground. Now, apart from that, the kind of projections that were made by the Dr. Mahesh Verma committee actually, is something that has really made the Delhi government rethink. And if you're looking at 5.5 lakh positive cases by the end of July, then that is a huge number. Even if you consider that only a tiny percentage of that number is going to need hospitalization. And if you look at the kind of graph that Delhi has shown over the past few days, remember 28th of June was when it crossed the 1000 mark. It took Delhi exactly 12 days to cross the 1500 mark, and just one more day to cross the 2000 mark. So you see how the numbers are simply galloping, and over the last 2 days we have reported more than 2000 cases each, and the number of single day deaths also are going up. So that is extremely worrying. So the government now is essentially working on a war footing. It is not just the Chief Minister's office, but even the Lieutenant Governor's office, who is the chairperson of the Delhi Disaster Management Authority. They are taking a slew of measures in order to step up the infrastructure in the national capital. The first priority is to convert every available space, whether it is in banquet halls, religious places, hotels, wherever space can be found, to convert that into makeshift hospitals. Enlist the support of RWAs, and so that people who can be taken care of in their own associations or housing societies can be taken care of. In fact, they've also thought of giving oxygen concentrators, cylinders, and trained civil defense volunteers at these places so that the pressure on government hospitals is less. On the second side, what they are thinking is to put a cap on pricing by private hospitals, cut down on ambulance pricing by private providers, and also cut down on COVID testing in the capital, because it is causing a huge distress on the ground, and the government has come under pressure to take these measures. Third thing is that all the 4 major hospitals in Delhi that are constantly in the news for wrong reasons, that is Safdarjung, RML, LNJP and GTB, they have come in for greater scrutiny. Lieutenant Governor has appointed a committee to look into all the issues of these, happening in these hospitals, starting from human resources to admission to protocol of treatment, and that committee is going to give its report tomorrow. And the fourth, on the fourth hand, they are trying to again re-strategize in terms of containment strategies, etc. Remember, today Delhi has 232 containment zones. So yes, it's now an all-out war against COVID-19 in the capital. Perhaps the government did not anticipate the surge of cases so suddenly, and also did not anticipate that people, will prefer to go to private hospitals and not, come to government hospitals at all.
Right. So now both the centre and the state are putting their heads together to deal with the crisis. Stay on with us, Rupeshri. Now, the Delhi government has ordered to set up 20,000 new COVID-19 beds in the national capital in the next 1 week. AAP spokesperson Sanjay Singh says that there are 46% beds still vacant and ready for emergencies. Listen in.
सर, बेड्स को लेकर जो बड़ा चैलेंज बना हुआ है, उसको लेकर किस तरह की बातें होंगी, क्योंकि जुलाई तक 5.5 लाख केस आ जाएंगे और उस हिसाब से बेड भी चाहिए होंगे।
दिल्ली सरकार ने जो अब तक बेड का इंतजाम किया है केसेस के हिसाब से, यानी जितने केसेस हैं और जितनी जरूरत हमको बेड की है, उसमें आज भी 46% बेड सरकारी अस्पतालों में और कुछ प्राइवेट हॉस्पिटल में और सेंट्रल गवर्नमेंट के हॉस्पिटल में खाली हैं। तो वो सारी जो दिक्कतें आ रही हैं उसको हम लोग देख रहे हैं, उस पर कार्रवाई भी कर रहे हैं। लेकिन जहां तक दिल्ली सरकार के प्रिपरेशन का सवाल है, हम लोगों ने अपने स्तर पे पूरी तैयारी कर रखी है और आने वाले दिनों में हम लोग अपनी तैयारियों को लेके पूरी तरह से सजग हैं और उसको लगातार हम देख रहे हैं।
चिंता की बात है कि यहाँ भी केसेस निरंतर बढ़ रहे हैं। कोशिश, दावे बहुत किए जा रहे हैं और गृह मंत्री जी आज बैठक ले रहे हैं, जिसमें हेल्थ मिनिस्टर हैं, एलजी हैं, दिल्ली के चीफ मिनिस्टर हैं, एम्स के डायरेक्टर हैं और भी जो विशेषज्ञ लोग हैं वो चर्चा करेंगे और कोई रणनीति अवश्य इसमें तय करेंगे और साधन उपलब्ध कराए जाए। दिल्ली में साधन नहीं है, जो बेड्स की कमी है, इंफ्रास्ट्रक्चर की कमी है, पूरी तरह से कमी है, तो उसके ऊपर भी मैं समझता हूं कि विशेष ध्यान देकर निर्णय लिया जाएगा।
Now, the Delhi government has announced its plan to add 20,000 beds across hotels, banquet halls and nursing homes of the city over the coming week to cope with the spiraling coronavirus cases. Uday gets us this report.
The Delhi government has passed an order mandating that all multi-specialty nursing homes, which have between 10 to 49 beds, such as this one that we're standing outside in Daryaganj in the national capital, these are small and medium nursing homes. All of these nursing homes, multi-specialty nursing homes, will be mandated, will be recategorized as COVID nursing homes for the duration of this pandemic. It is projected that Delhi will need somewhere around 15,000 COVID-19 beds and by the end of June, and will need over 30,000 COVID beds by the end of July. So to make sure that health services within the national capital are not overwhelmed, the Delhi government has in fact passed this order. Several specialty nursing homes such as maternity or fertility clinics or ENT clinics will be exempt from this law. So to make sure that the national capital and its health services are not overwhelmed, Delhi government has passed this order concerning small and medium nursing homes across the national capital.
Now, with nearly 12,000 cases in the last 24 hours, India's total tally has crossed the 3.2 lakh mark. However, the recovery rate has improved to cross 50%. Over 8,000 patients have recovered today, making the total number of recovered patients more than 1.6 lakhs, which is higher than the number of active cases. Now, while Maharashtra, Tamil Nadu, Delhi, Gujarat and Rajasthan continue to record 5,000 active cases, states like Bihar, J&K, Jharkhand, Nagaland, Rajasthan, Sikkim and Uttarakhand have recorded more recoveries than new cases. According to the global real-time data compiled by Johns Hopkins University, India's count of recoveries is now the 6th largest in the world after the US, Brazil, Russia, Italy and Germany.